All right, thanks, Jim. Hey, they are furry little kids, aren't they? But they get into trouble sometimes. I'm talking to you, Rosie, here, but they can't tell us what hurts. So the question is, how do you know when an injury, whatever it may be, is serious enough to go visit our vet? Well, IndyVet's Dr. James Speiser and Rosie are here with some ways to spot trouble. Thanks for coming in and putting the focus on our pet's health. We're going to start with the eye area.
Yeah, thanks, Ray. Well, eye injury is very common in both dogs and cats. So how do you know if it's a real problem? Well, if they're really heavily squinting, there's a tremendous amount of
squinting.
Yeah, squinting. They won't let you look at it. A lot of tearing, or if any part of the clear portion of the eye, the cornea, is discolored or cloudy in any way, that's something that should be
And
looked
they'll be
at.
scratching at it. You can tell it's irritated.
Well, if it's a little bit red, or they're rubbing it a little bit, but they really don't seem to be bothered by it, probably that's something that's not urgent and you can wait. But if it gets any worse, by all means, the eyes are a delicate organ, have it evaluated.
Pause.
Torn toenails, very, very common problem. If the nail is completely off and it's bleeding, then you can take like some flour, cornstarch, styptic powder. You can apply that to get it to stop bleeding. Then you can bandage it for 10 or 15 minutes and you're fine.
Watch it. If it keeps bleeding, then maybe a vet
Well,
visit.
it won't keep bleeding. It'll stop. Now, say if the nail is partially off and it's bleeding, then you got to have that nail removed. I may have to go to the veterinarian to have that, or if you're brave, you can take like a pair of pliers and yank it off, and then go ahead and take care of the bleeding as we discussed before.
Other concerns would be?
Bite wounds. Bite wounds, very common, particularly in big dogs, little dogs, or dogs and cats. They can be very deceiving because all you see is just a couple of puncture wounds, but underneath it can be very, very serious. Always a risk for infection, so bite wounds are something that should always be evaluated by a veterinarian.
Every time. I see Rosie is eyeing these Legos.
Yeah, you know,
Keep
they'll
Rosie.
eat anything. They'll eat anything. So say your dog or cat is vomiting over and over and over, and they're lethargic, maybe they brought up some material you can't identify, that's something that probably should be evaluated. On the other hand, if they vomited once or twice, they're still happy, healthy, they're running around, they're interested in food, that's something that probably can be waited on a little bit. You just withhold food for 24 hours and see if it resolves. If not, then have them evaluated.
Good to have you here. Dr. James Speiser with IndyVet. If you'd like any information about IndyVet service or educational opportunities, head to fox59.com. Rosie, you stay healthy and we'll see you next time. All right, 9:47. Let's talk to Jim and talk about what's happening.